Hi, I'm Nick Beechey-Newman. I'm a consultant breast surgeon and I work here at the Harley Street Breast Clinic at 148 Harley Street and at the London Bridge Hospital in the Shard. I also do a clinic in the city at 31 Old Broad Street. Although the most important part of my role is the surgical treatment of breast cancer, when I'm not operating, I also run a number of one-stop breast clinics. So these clinics for anybody who has any concern about their breasts, such as a breast lump, breast pain, changes in the nipple, nipple discharge. And at a one-stop breast clinic, we're able to do all of the investigations that are required to reach a definitive diagnosis. So that may be a mammogram, an ultrasound, or a needle biopsy. And at the breast clinics that I run, we are able to do those tests within about 2 hours and give you all of the results of those tests by the time you leave. My areas of expertise in research include the avoidance of mastectomy in patients who have been diagnosed with breast cancer, sentinel node biopsy, which I helped to initially introduce in Europe in around 1995, nipple discharge and the diagnosis and treatment of breast cancer in younger women, which means under the age of 35. If you have a breast problem, feel free to contact my team and book an appointment at a one-stop breast clinic. Breast pain is a very common symptom, and usually it's due to hormonal changes in the breast. Often this gets more coming up to each period, which is caused by the higher estrogen levels just before a menstrual bleed. However, some people with hormonal breast pain just get constant breast pain throughout the month. Some women with breast pain do just have it in one breast or just in a part of one breast, but actually having breast pain as a sign of breast cancer is very unusual. It's almost a diagnostic sign of a cancerous lump that is not painful. A few women who have breast cancer do feel a kind of altered sensation, which is not a pain, perhaps a pulling sensation in the breast a few months prior to feeling a lump. It's a common conception, I think, that cancerous lumps may be difficult to pick up, but in reality, 90% of breast cancer lumps are really very obvious. I think the two most important things about cancerous lumps is, firstly, they're surprisingly hard. So they have clearly a different consistency than the surrounding, much softer breast tissue. The second thing about malignant lumps is that they're usually very well defined. So they're a really separate, circumscribed lump. And if I gave you a pen, you could easily draw a line around it. So those two things together, the fact they're a hard and separate lump, means that most cancerous lumps, if you do try to feel, you have a really good chance of feeling them. Of course, some women will be diagnosed with breast cancer at these clinics. And the way that they're run is that the full result of the core needle biopsy usually takes a day or two. So although the patient will be warned that this is a likely outcome, it doesn't come as such a shock because the full diagnosis won't come through for a day or two. This seems to work very well, actually, in breaking the bad news. Obviously, some patients will have adequate private medical insurance, and subsequently all of their breast cancer treatment can be carried on from there under their private medical insurance. If they don't have private medical insurance, some patients come to the one-stop clinic because they're very worried and they don't have private medical insurance and they pay for it themselves. Then we can easily arrange their transfer back into the NHS by providing them with all of the information, including the scans and pathology reports. And I will provide a comprehensive summary of their visit to the One-Stop Breast Clinic letter, which we can then forward via their GP onto their local breast clinic. Self-payment for breast cancer treatment in the UK is pretty expensive. The surgery probably costs around £5,000 or £6,000, which some people definitely do themselves. Chemotherapy is considerably more expensive, and radiotherapy also. So those can be done usually through the NHS, and some patients do mix and match and perhaps have their surgery done privately and their radiotherapy perhaps done through the NHS. Everything in your breast is very hormone dependent, and most breast pain is just caused by natural hormonal changes. Often this is felt more in the week prior to each menstrual period, because that's the time when your estrogen levels are highest. However, breast pain can often be just constant throughout the cycle. Some women with breast pain just have the pain in one breast, and sometimes just in a localized area of one breast. However, breast pain is rarely caused by breast cancer, and it's very unusual to have a cancerous lump that is painful or tender. Majority of breast pain is hormonal in origin, and it's often due to just transient changes in hormones. So often breast pain will persist only for a few weeks or perhaps a month or two. Often, therefore, no treatment is required. If, however, breast pain is more persistent, there's a very good natural remedy, which is called starflower oil. I found this to be a very effective and natural remedy. You can buy it in bigger chemists. It's usually in the vitamin section or in Holland Barrett. You need to take 1 capsule a day, which is 1,000 milligrams. I found this to be amazingly effective, and I actually rarely meet anyone who it doesn't work. So this is a very good natural treatment that has really very few, if any, side effects, and can be, if necessary, taken on a kind of long-term basis. It's unusual for patients to have persistent and severe breast pain that needs any other kind of treatment, although there are hormone blocking tablets that can be occasionally used in those kind of situations. Sometimes localized breast pain can be due to a large simple cyst, and if this is the case, often there'll be a lump that you can feel. In this case, you can have the cyst drained off under ultrasound control, and that will bring immediate relief. Most cases of breast pain do resolve anyway, but if your breast pain is persistent and troublesome, there are nearly always ways that it can be dealt with. So certainly I'd advise making an appointment to see your GP.